component is separate from the hormone-producing component with that female. But the more follicle-stimulating hormone, the more that follicle grows, the more estrogen we're going to produce. The next stage, we're going to pick the bestest-looking primary follicles and continue to grow them into secondary follicles, just like we picked the best-looking plants and pull all the little ratty ones that didn't sprout properly. At this point, the follicle is going to start to thicken because it's going to start enlarging, kind of like a big old bubble. And we're going to start making follicular fluid. This is the fluid that surrounds the egg, making it easier to catch, protecting it when it's out of the ovary. And this is what the sperm has to eat its way through to fertilize that egg. So we're going to be growing that at this point. Just kind of imagine a balloon bubble that's filled with water, and there's a little bouncy ball somewhere in there. So we just keep adding water, adding follicular fluid, adding follicular fluid. Stage 3, we're going to turn those secondary follicles again into those tertiary or those mature follicles. So step 3 happens around 8 to 10 days of the cycle. Okay, so at this point, we're going to pick the bestest one, like you're going to pick the bestest pumpkin to take to the fair. So we're going to take that one great secondary follicle and grow it up and mature it over the next 10 to 14 days until it becomes that Graafian follicle, mature follicle. I think sometimes you'll see it called tertiary follicle. So this is the guy that's about to burst. He's about to ovulate and release that egg. All of the other follicles, the primaries that weren't picked, the secondaries that weren't picked, they're just going to disappear. Okay, they're going to continue to disintegrate with astrasia issues. So we again waste a lot trying to pull out the bestest one, just like you might waste a lot of seeds just so you can get one really good pumpkin that year, or watermelon, or whatever you happen to be growing. Then we go into the luteal phase, or the post-ovulatory phase. And of course, post-ovulatory because it happens after you ovulate, and luteal because this is going to be dominated by luteinizing hormones. So LH is going to be the dominant hormone from the pituitary gland, and progesterone is going to be the dominant hormone from the ovary. So we're going to take that tertiary follicle, Graafian follicle, mature follicle, and we're going to pop it. So that burst of luteinizing hormone is going to rupture that wall of the follicle, releasing the follicular fluid and the egg. And again, that follicular fluid is sticky, so it gives it a bigger target for those fimbriae to grab a hold on and bring into the oviduct. Now, after we release the egg, we've exploded the follicle collapses on itself and becomes the corpus luteum. And the corpus luteum is going to produce the progesterone. So a female can only make progesterone if she has ovulated. So if you prevent her from ovulating, you will prevent her from having progesterone. And again, this is what some of those ovulating tests look for. They look for the presence of either high luteinizing hormone, or they look for the presence of progesterone. And that indicates that we have had a launch and we need to go fertilize if you're trying to fertilize. Now, that corpus luteum will continue to produce progesterone for a few days until it kind of runs out of steam. If it doesn't get any message coming back saying, hey, there's a bun in the oven, we need to keep everything in the, the cooked state, then it's going to shut down. So roughly 12 days after ovulation, if there's no feedback loop from the uterus indicating that there is a pregnancy, so there's no fertilized egg, there's no reason to keep everybody around, the corpus luteum is going to break down into the corpus albicans. And again, alba meaning white, so it's a little chunk of white scar tissue. And of course, once it's a scar tissue, once it's albicans, it stops producing progesterone. Yes, ma'am.
So with it stopping the progesterone, does it start another hormone to make the corpus albicans?
So basically, once we stop producing any kind of hormones, it just kind of withers away because it dies off.
So it's not like
No. So it just the albicans is just the withered up scar tissue left over from overuse. So it just goes away. Now you can count these. Now we usually don't do this with people because again, weird and creepy. But if you've again hunted deer, sometimes they'll ask you to bring in kidneys. Sometimes they'll ask you to bring in ovaries. Sometimes the whole carcass. But they can take the ovaries of a deer and see how many times that deer has ovulated. So normal populations, deer only ovulate once a year, so they only have babies once a year. So if you have a 7-year-old deer, because they can check teeth for that, and you only have 5 corpus albicans on her ovaries, then we know obviously the first year she's a baby, so she didn't ovulate. There was 1 year where she wasn't able to ovulate, and that might indicate issues with the environment, issues with the herd, maybe she was sick, that scenario. So they can use the how often a female ovulates in the herd to indicate if that herd is starving, if that herd is successful, stuff like that. Down in South Texas, that's how they confirm they're having 2 breeding seasons a year instead of 1, which is why there's so many freaking deer down south. You ever drive down south?
No,
It's like every mile there's a dead deer on the side of the road because stupid people feed deer. It's like, why don't you just go feed the rats? Same thing, they just breed. Right? And if you don't have natural predators, because people tend to scare off natural predators because they would eat us too, you have deers that have no regulations and they just grow. So actually can lead to a lot of problems, destruction of environment. Shoot deer.
Shoot deer.
Okay. So here's our follicular phase dominated by follicle stimulating hormone. And again, we're going to get more and more luteinizing the closer we get to ovulation. And then we have that ovulation, we've got that spike. And then, of course, we're going to have the corpus lutein producing progesterone. And then after it stops producing, it's going to shrink away, becoming the corpus albicans, and we pick up with the next part of the cycle. So uterine cycle. So what is the uterus doing during all this craziness? So we start the uterus cycle with menses because that's pretty much when you know something's going on with the uterus. You can confirm, yes, there's a period happening. So menses, or the menstrual component. That's going to be day 1 through 5. This is where the functional layer is sloughed off. You will have some bleeding occurring with that because you're pulling off tissues and getting rid of it from the body. And of course, 1 to 5 is average. It can last as short as 1 day. It can last as long as 7 days. If you have endometriosis, it could last even longer. It just depends on the ovaries. The more estrogen you produce, the thicker the functional layer, the heavier the period is going to be. And again, this is why women who are on birth control, especially the estrogen versions, have shorter, lighter periods because they limit the estrogen production, thus limit the functional layer production, and that makes the periods lighter. In some cases, you don't even have periods anymore because the estrogen is at the right level. We don't really make any functional layer, it just kind of sits there looking at us funny. So the length of that period is a good indicator of how much estrogen you produce during that part of the cycle from the ovaries. So if you are unmedicated, so natural wild periods, they again are good indicator of hormone levels. Now, on average, a female is going to lose about 35 to 50 milliliters of blood, plus about 35 milliliters of serous fluid, as well as the tissue. Okay, and again, this is how they can tell menstrual blood from normal blood, because normal blood doesn't have functional layer chunks in it or serous fluid in it. It's got stuff in it other than just blood that's going to be coming out. Now, dysmenorrhea, again, we've learned dys means difficult, so this is painful menstruation. So cramping while you're having your period. And this can be caused by several factors. The biggest one is muscle contraction. Your smooth muscle contracts for like 3 days once a month. And if you exercise crazy at the gym 3 days once a month, you'd be sore too. So cramping while period is again often due to muscle contraction. It can also be contributed to or added to from inflammation. And this inflammation can be the tissue as it's dying can cause inflammation. If you have a UTI, if you've got an STD, those can contribute as well, making the cramps worse. Any kind of issue with the adjacent pelvic structures. Unfortunately, when the uterus is contracting, because smooth muscle, again, is controlled by chemicals and local contractions, if that uterus is close to your rectum and it's contracting, your rectum's like, me too, and you get period poops, which can cause cramping in the rectum, which is just, everything hurts down there. Okay? So everyone's just letting you know what's going on in your life. Proliferative phase, day 6 through 14. This is when we rebuild the functional layer, so the tissue proliferates. Now, it doesn't wait around. If you have a 1-day period, it's not going to sit there until day 6 before it starts. So if you have a 1-day period and then day 2, period's done, you would start the proliferative phase at that point. So this is why sometimes women may have a really heavy period 1 month and then a really light period the next. That heavy period indicates maybe they had a longer proliferative phase. Maybe they produce more estrogen. Those lighter ones might mean we had a shorter proliferative phase. So sometimes you may have a super heavy period 1 month followed by a really light period because it throws off your days for building of that functional layer. This is going to occur at the same time as the primary and secondary follicle development. So we know if you are building functional tissue, then that means your follicle is growing, you are preparing for ovulation. So estrogen is going to be your dominant hormone, follicle stimulating hormone is going to be your dominant hormone. So again, the more estrogen you produce, the longer you produce estrogen, the thicker the proliferative period is going to be, the thicker the functional layer is going to be. Secretory, this is where we've switched gears. This is after we've ovulated, and once we've ovulated, progesterone becomes the dominant hormone, and it's the progesterone that is going to reign during the secretory period. So as long as you are producing progesterone, your uterus is stuck in the secretory phase. So it lasts as long as the corpus luteum does. So if you're pregnant, your uterus is stuck in the secretory phase. Okay, so that entire 9 months, it's going to be sitting there in this phase. And then you have a period. In case you were pregnant, it's a period with a baby. It's like a Happy Meal. You get a prize at the end. I don't know how happy that meal would be, right? But it's just a period of stuff. Stuff happens, blink at you and want to do stuff like that. So this is day 15 to day 26. So during the secretory phase, it's called secretory phase because all those glands we built in the functional layer now become secretory. So they're going to start producing the mucus, making it a safe, supple environment for the egg to burrow into and be successful for a pregnancy. It's going to produce that mucus to make it easier for the sperm to swim upstream. So hopefully they can get to the egg and fertilize it. So to help out with the ability to have offspring.
And you said this is the time when the cervix and everything else gets really spongy and fluffy, you said?
The inside of it does.
Inside of it?
The cervix just has a lot of mucus coming out of it because of the mucus produced in it. So it kind of makes a mucus trail that the sperm can swim up easier. So a lot of females can confirm if they've ovulated, they'll have more discharge around that time of the month. Then premenstrual phase or the ischemic phase, day 27, day 28. And again, some people recognize this phase because there are physical changes to the uterus, physical changes to the human body, and other doctors are like, nah, you're just faking it. Again, it depends on who your doctor is. That's the unfortunate thing. There's still a lot of mystery about females because they forget to do things like ask females what's happening with their body. Don't you hate it when that happens? Yeah. It's like a few years ago, they actually published a paper where a doctor confirmed that pre-period cramps are painful. You're like, wow, you did science to figure that? You didn't just ask your mama? Something like that. And why are they painful? They're caused by the same stuff that causes a heart attack. So ischemia, when you have ischemic, you have lack of oxygen to the tissues build up lactic acid, the tissues start to die. So the angina pectoris, the heart suffers from ischemia, is the same thing that causes pre-period cramps in the uterus. The difference is that functional layer just goes ahead and dies on you. So again, you're not wanting to flush a living tissue because a living tissue would bleed a whole lot more, have a lot more problems and damage. You want to flush a dead tissue. So the stratum functionalis has to die before you have your period. So it's going to have to cut off blood flow. So those capillaries that are associated with the endometrial lining are going to constrict down, reducing oxygen and nutrient flow to the tissue, killing off that tissue. Yes, ma'am.
So going back to the birth control conversation on this, the ones that stop it, does that mean that tissue just builds up until you have your next period, or it stops this from happening?
So a lot of times when you've got those chemical birth controls, they're high enough, they trick the body that they have this level of hormones. So that means they've already done all the prep work when it actually doesn't do the prep work. Okay. So that's why the smaller, lighter periods, because if you build a functional layer, it's very, very thin. And some women don't even build a functional layer because the estrogen is kept at such a low level that they don't end up having any period. So that's one of, I don't know if some people say fortunate, some people say not fortunate, but the side effect of some birth controls, your periods may become irregular or absent altogether because you're just not building the functional layer, so there's nothing to get rid of. Yeah.
Can nitroglycerin tablets, like oral tablets, help provide more oxygen to those areas that have less oxygen and more lactic acid in them? Or is that strictly
I'm just thinking, I'm having cramps, get the nitro.
Hydroglycerin.
It'll help. It's not going to help as much for the uterine because
It's more for the heart.
it's not blockage of blood vessels that's causing it. It's they're actually constricting and killing the capillaries. And by constricting and killing the capillaries, you're going to cut off the oxygen going to the tissue. So providing it with more relaxation, dilation of the blood vessels isn't going to have to help the fact that capillaries are dying off. And cramps suck, but you want that to happen because if you try to flush a living tissue, you're going to have a lot more bleeding, a lot more blood loss, a lot more damage. So you want to kill it before you remove it. Okay? It'd be like if your scab was still having oxygen and nutrients going to it. Scabs would be gross. Yeah, we want to kill it first.
Okay.
Get it all. Okay? It just hurts when you kill it because everything hurts when it's dying. Okay, so those hormonal shifts, again, those hormonal shifts, we're shifting from having progesterone dropping off, and then estrogen is coming back in, and as estrogen comes back in, of course, it's going to affect ion and fluids balances, which is why we may have swelling and bloating and stuff like that, because of the way estrogen manipulates water and ion levels within the body. Of course, we've got baby cramps caused by ischemia. So this is the difference between the different types of period cramps. Period cramps during a period are due to muscle contraction. Period cramps before the period actually starts into maybe the first day-ish, that's due to ischemic issues. Okay, so different causes of those different period cramps. Why make it easy on us? Have a variety of cramp issues. Right? So lots of hormonal shifts and physical changes that female experiences. Again, some doctors are just like, it's just a hormone shift and your tissue dies. It's not considered good enough to be a phase. And you're like, bite me. Go do something else after you're again, menarche is your very first period when you hit puberty. So let you know you've got the curse and you're now a woman. Girls have to have at least 17% body fat to start having periods. So again, this is why we see so many girls having periods earlier than we did, 10, 20, 30 years ago. So in the 70s and the 80s, it might be 12 when you first have your period. Today, it might be 10. And a lot of people are like, oh, it's because of the hormones in the environment, the blah, blah. It's the cheeseburgers, honey, you're squishy. If you're overweight, you're going to have periods faster than if you're underweight. So if you are anorexic, you may not have your periods on time. This is why, again, female athletes, if you look at gymnasts, stuff like that, they don't start periods until much later because they have like 0% body fat, which is why a lot of gymnasts are built more like men than like women. They didn't hit puberty like they're supposed to. So they're not going to have those female features that we associate like they're supposed to. Menopause is when you pause your menopause, okay? So that's your last uterine cycle. That's when we often use the term postmenopausal women, because unless you're having a hysterectomy next week, sometimes it's really hard to tell if this is the last one. It's like, it could be the last. No, there's another one. Okay, so the last one you have before you don't have any more. This is going to occur again when you have about 1,000 eggs left. After that point, what's the point kind of scenario? And again, as we mentioned yesterday, because of birth control methods, stuff like that, we are seeing women going through menopause later and later because we're not using all those eggs, because if you're on birth control, you're not going through the normal cycling and you're not using up the eggs and ovulating each month. So if you're on birth control for 10 years, that's 10 years worth of cycles you're not having. And those eggs just don't disappear. So they kind of get added on to the end of your sentence kind of thing. So yay, you don't get pregnant today, but good news, you get more periods. So you kind of have those issues that you have to deal with. And this is what we're seeing in today's medical realms. We're seeing older and older females still being reproductively viable, meaning that she can still get pregnant. So having a 6-year-old woman pregnant 30 or 40 years ago was laughable. Now it's doable, and it's a little terrifying because you have issues that pregnancy causes, and then you have issues that old age causes. And I don't know, call me crazy. Other than not wanting to deal with children at 60, mentally, it's like, I don't want to deal with my children now, and I'm not 60 yet. But could just imagine if you're 60 and you're pregnant, which means the odds of you actually seeing your kid graduate from high school are almost zero because you have to live to be 80, and then you're never going to see your grandkids. Okay? You're going to be lucky if you make it to your kid's puberty just because of age issues. Okay? So it's going to completely change a lot of the dynamics that we see out and about in the world. Kind of kooky. Oh, there she is having trouble. So again, estrogen being your dominant, so that's going to happen with the menstrual phase, the proliferative phase, the build and build. And again, we can see during that last little push as we're getting ready to ovulate, we get a big surge in estrogen, so that it's going to finish up any of that building. And then we, again, tag team it. We go to progesterone being dominant. Once progesterone is being dominant, we're going to be in the secretory phase, so actively secreting, making that mucus a nice, safe place for the eggs to land. And then when we tag team again, progesterone drops off, the estrogen comes back, that's going to kill the tissue. Okay, so anytime estrogen comes back, you will have a period. If you are not pregnant, you have a normal period. If you are pregnant, you have a child. It's the same kind of scenario. It's just size difference and content difference in the uterus. Okay. This one does show the premenstrual phase. So some people recognize it, some people do not. So proliferative, rebuild it. Secretory, let it make some secretions. Menstrual, let it die and fall off. Okay. So again, estrogens versus progesterones with our menses, our proliferative phase, our secretory phase. So this one does not give us premenstrual phase. This one's showing you the body temperature. So some of the old school methods of predicting if you've ovulated, whether you're trying to get pregnant or trying to avoid getting pregnant, is to look at your basal body temperature, which is the temperature when you first wake up in the morning. So you want to have that first time in the morning because that's when you're not active. If you start moving around, your body temperature starts changing based on activity levels, and then it becomes a little bit skewed. So you will have a spike in temperature about the time you ovulate, which again allows you to predict when or when not to have sex. But you do have to have a really good thermometer. You're looking at a spike between a little bit below 36.4 degrees to about around 36.7. So you have to have, again, good thermometer to pick up those decimal points of changes. So it's not like a huge hot flash or anything like that. Right. Clinical issues with the females. So again, looking at cancer just like we did the guys, lung and bronchus cancer, still leading cause of cancer deaths, but it's at 24%, so a lot lower than what we saw with the males at 31%. Breast cancer, second leading cause of cancer deaths for females at 15%. Now, breast cancer is not actually a female disease. So again, unfortunately, it's misbranded, it's colored pink. Males can get breast cancer. It's just more frequent that females get breast cancer because we have active breast tissue. We have lactation that goes on and all that kind of fun stuff. With guys, they have rudimentary breast tissue that unless you produce enough estrogens, they're not going to develop into breasts. So they don't have breast cancer issues as much, but it is still possible to get breast cancer as a guy. The original guy who played Shaft in the 70s, that's why they had to cancel that show, even though it was popular. He got breast cancer and he had to go through treatment. And there's something about breast cancer that just makes, sexy, investigator less sexy or something. Okay, so you can get it if you're a guy. So it's not a girl disease. So it really shouldn't be pink. It's very biased.
So can tumors and cancer develop faster within fatty tissue? Is that
No.
No? Okay.
It's not the fat that's getting the cancer. It's the actual glandular material getting the cancer. And just like with guys and testosterone making prostate issues worse, girls, it's estrogen. So if she's making more estrogen, it can make her more susceptible to excessive growth because testosterone, estrogen, and progesterone encourage body growth. So this is why they used to do estrogen therapies when women went through menopause, so they didn't have as many menopausal symptoms. And then they noticed a huge uptick in breast cancer. And they're like, oh, maybe we shouldn't be giving the old ladies estrogen. That's going to cause some problems. So now they don't do estrogen therapies. And that's why when you have estrogen birth control, it's very low levels of estrogen. It's not higher to prevent a risk of breast cancer as a side issue.
And so steroidal use is another reason, because of the encouragement of tissue growth, that's another reason why you see more cancer and tumors growing within people that use steroids? Okay.
Yep, because it's a stimulator.
Okay.
Ironically, if you do steroids as a guy, you can actually end up with gynecomastia.
Yeah.
So it's like there's a side effect you didn't expect coming. I'm super manly in my deacon. So you do have to be careful with any of those hormones, estrogens, progesterones, testosterones. They're all going to do a lot of the same stuff. They're all steroid-based hormones. So they can manipulate DNA and cell activity, which allows them to cause excessive growth. Colorectal cancer, third leading cause at 11%, pancreatic, fourth leading cause at 6%. Again, so 1, 3, and 4 are still the same if you're a guy or a girl, but the numbers are slightly different. And again, they're not quite sure if it's just because you're a dude or versus a girl, or the fact that, you know, more guys might smoke because it makes you look more manly, like DNA-based issue, or is it a social-based issue kind of thing? And then we have ovarian cancer, fifth leading cause of cancer death in females, leading cause of death of gynecological malignancies, so girl cancers. So if there's going to be a girl cancer that takes you out, it's your ovaries, because you know they're evil little things. So we exclude breast cancer because it's not considered a girl cancer, a gynecological malignancy, since guys can get it. So the reason why ovarian cancer causes so many problems is a lot of the early symptoms of the cancer growth on the ovaries is heavy periods, severe cramping with your periods, irregular periods, random abdominal cramping. That just sounds like you're a girl. Okay, so unfortunately, many of the cancer that is growing in that ovaries can change the estrogen levels, progesterone levels, can make periods heavier, more irregular, and stuff like that. So many of those early stages are lost because it's just typical, you know, business as usual as a girl. I'm just having a bad period this week, or I'm just having a really crampy time this week. But in actuality, it might actually be the ovaries trying to kill you. So our leading cause of death at 5%. So it usually metastasizes elsewhere before we catch it because it's really hard. It's not like the prostate. You can do a PSA level to see if you have prostate cancer. You pretty much have to scan and look for these actively. So there's not an easy way to do it like a blood test or anything like that. Other type of gynecological cancers would include uterine cervical cancer. Again, this is why girls get pap smears every so often, so they can check to make sure the cancer cells aren't there or the cell growth is just normal. Uterine corpus endometrial cancer. If you have endometriosis, which is excessive growth of the functional layer, so if you're lucky, that extra growth is inside of the uterus, so you just have heavy, very painful periods. And again, this is why the periods are so painful. You have more tissue to kill, so bigger pre-period cramping, and more tissue to get rid of, so bigger during period cramping. So if it's in the uterus, you know, I don't want to say be thankful for that, but it's better than, unfortunately, sometimes that endometrial lining will actually grow up the fallopian tubes, grow out of the cervix into the vagina. It can actually grow onto the outside of the uterus, and then it becomes a lot more problematic because it doesn't get shed like it's supposed to. And if it doesn't get shed like it's supposed to and keeps growing like crazy, it tends to become cancer. Okay, so that's why endometriosis is monitored. It can affect fertility, but it can also affect and lead to cancer issues, especially if it escapes the uterus. You can have cancer of the external genitalia, you can have cancer of the vagina, anything can get cancers. But again, it's the ovaries that are going to cause the most problems. That's just life. The ovaries cause the most problems. PID, so pelvic inflammatory disease. As we mentioned, there is a gap between the ovary and the oviduct. And because there's that gap, if you have an STD or any kind of infection that spreads, it can, when it hits the end of the fallopian tubes, instead of just being directed straight to the ovaries, affecting just the female reproductive system, it can now spread anywhere within the pelvic cavity. So it can start spreading into the digestive system, into the urinary system, from the inside, causing a lot of problems. So it gives you PID, pelvic inflammatory disease. Your entire body wall in your pelvic and abdominal region, it has an infection, and it's inflamed and painful and problematic. So again, most often associated with STDs, gonorrhea is the most notorious for causing problems because if it just needs a moist membrane. So you can get gonorrhea in your mouth, in your throat, in your digestives, and anywhere that's moist that it can get to, it can get to. So gonorrhea can cause a lot of problems. Okay. Ectopic pregnancy. This is when that fertilized egg implants somewhere other than the uterine lining. So it doesn't have, again, it's not consciously aware of where it's located. It's not purposefully implanted. It just gets to a certain point in their development and it just implants. And if it didn't make it to the uterus, if it implants into a fallopian tube, of course, that's going to be problematic because the fallopian tube cannot stretch like the uterus. So as that pregnancy grows, around 9 to 10 weeks, it'll actually blow out that fallopian tube if it's not removed in time. And of course, that's going to ruin your ability to have children. You still can have them, but it cuts your fertility in half because you've just knocked out one whole side of production. So now it's the other fallopian tube and the other ovary that you would have to count on to get pregnant with versus the one that you've just cut off flow tube. And of course, if you have that case where you have the ovulation out into the pelvic cavity before the fimbrate can catch it, if it gets fertilized and starts settling, it can settle on the outside of the uterus, it can settle on the peritoneum. These guys, again, very, very problematic because, again, the uterus is made to have the detachable inner layer and get rid of it. That's what it does. These other parts don't have a detachable layer. So if you have that baby growing on the outside of the uterus or on the digestive system, that's a major health concern because obviously they can't get out. So you have to have a C-section. But since the tissue isn't made to die and fall off, you can have massive internal bleeding whenever you go into labor if the placenta detaches. So most of your ectopic pregnancies are terminated because successful ones are very, very rare. And if you remember back when they were having those debates about abortions and stuff like that, there was some idiot politician, because that's pretty much sums it up right there, idiot politician. He had this thing, is like, well, if someone brought up, what if you have an ectopic pregnancy and you have to get an abortion for the health of the mother? And they're like, well, you could just implant it back into the uterus. It's like, you need a biology course. Once it's already committed to be implanted here, it's very rare to get that placenta to reattach to the inside of the uterus before the baby dies. So it's very, very hard to do that. It would require oftentimes microscopic surgery, which is just unheard of. Okay? So again, that just shows how stupid that guy is. But again, idiot politician ruining the world kind of thing. It can happen, but very, very rarely will it reattach. Okay? Back in the day when there was the health network, remember when they used to have Discovery Health before Oprah bought it, called it OWN? Stupid cow. Anywho, there was unbelievable pregnancies. One of them was a lady who had an ectopic pregnancy, but she didn't realize it. So with her pregnancy, she had severe abdominal cramping and bleeding, and she thought she was miscarrying. When she went to the doctor, they're like, everybody's fine. We don't know why you're bleeding, but you're okay. She had 2 healthy babies in her uterus. And then later at a different sonogram, they're like, and you have one on the outside. So she had triplets. And go figure, it was the boy child that got lost and implanted somewhere he wasn't supposed to. The girls made it to the uterus where they're supposed to be. The guy's like, it's good.
Guys always take the wrong turn.
Exactly. They don't ask for directions. So what the massive bleeding she had was actually her fallopian tube rupturing, and it reimplanted on the outside of the uterus. So she had to be bedbound from that point on. So, week 10 of pregnancy all the way to the end, she couldn't get out of bed. And of course, because if she rolled over, it could detach the placenta, killing them all. So when it was time to go in for birthing, of course, she didn't birth normally, and she had to do it a few weeks early, but they had to surgically go in and remove the baby, clamp the cord, and then surgically remove the placenta to minimize bleeding on the outside. And then they were able to go in and do C-section for the girls to bring them out normally. So it was a very, very, there was like 1 in billions chance that that baby re-implanted somewhere else. Unfortunately, it was still in the wrong location, caused issues, that kind of stuff. So very rare for them to be successful. Yeah. So they do the same opening C-section wise, but then they had to go in after they cut the cord, they had to go and cauterize and cut through all the blood vessels of the placenta so she wouldn't bleed out internally, and then remove the placenta and then go in for the girls.
Interesting.
Yeah. So very, very, very low successful rate for the pregnancy for both mom and child. High death rates on those ones. So they were lucky. If I was her, I'd shut down shop immediately. Be like, no, always survive a miracle. No hits. Amenorrhea. Amenorrhea is a stoppage of normal uterine cycles for 6 months or more. So again, if you miss a couple of periods, your doctor's like, that's okay. Come back to me when you've missed a year. Okay, so they're not really going to worry about you until after about 6 months. And this, of course, is the stopping of a normal uterine cycle if you're not under any kind of birth control. If you're under birth control, they're like, you got birth control, you're fine. So this is unmedically caused stoppage of our uterine cycles. So primary amenorrhea, this is where we don't start a period. So if you're 17 years old and you haven't had a period yet, the doctors are going to see why are you not having a period, because you should have had one by now. So this can be due to abnormalities with the development of the body. So you could have non-functioning ovaries. So obviously if the ovaries don't work, your uterus isn't going to work. Absence of a uterus. Some women are born without a uterus. It's rare, but it does happen. There are also cases where sometimes women are born with pieces of uterus. They're not going to form a full one. They just have like little pieces. Some of them can be surgically spliced together. Some of them cannot. Endocrine disorders. Obviously, if you're not making follicle stimulating hormone, luteinizing hormone, estrogens, progesterones, all that kind of stuff, you're not going to have normal periods. Or a genetic disorder. So there's some kind of genetic reason, a defect in your cells, the reception of hormones, that scenario that stops you from having a period. Or malnutrition. So again, if you're starving, there's not enough fat for you to survive. So there's definitely not enough fat to worry about recycling tissue and having pregnancy. So if you don't reach that 17% level of body fat, you are not going to kickstart your puberty. You're not going to kickstart that period. So again, this is due to those low leptin levels that encourages the pituitary gland to release follicle stimulating hormone and luteinizing hormone. So again, this malnutrition may be because you're starving, or it could be because you're so athletic. So if you were in gym, if you're a gymnast and you've been a gymnast since you were 7, you may have issues, or ballet dancers and stuff like that. If you've never had the period, then it would be primary amenorrhea. Secondary, you've had one, at least one, but now they've stopped. Okay, so you've been a woman at least a little while. So physical or emotional stresses can cause this, because again, physical stresses, emotional stresses can affect your hormone levels, can affect your feeding, right? You can have depression and the hypothalamus doesn't tell you you're hungry and then you just don't eat, all kinds of stuff. So with those physical and emotional stresses, if you have massive weight loss, depressions, those guys are going to cause issues. You have to have 17% body fat to start puberty, but you have to have 22% body fat to maintain it. So if you lose too much weight, you're starving yourself, or you're anorexic, that scenario. Or if you just don't have body weight because you're too fit. So you're a marathon runner or a gymnast or a ballerina where fat is frowned upon because you're wearing really skin tight suits that everybody's going to see everything. You don't have the fat, you don't have the period. So it's very common for those athletic women to stop having periods altogether and then have problems with fertility afterwards. Yes, ma'am?
Why does that happen? When I'm upset, like I used to not hungry. It's not even like I'm just like I'm not hungry. Like my body just shuts down like I'm not hungry at all. Why is that?
Because you're lucky. The rest of us like eat a whole cake. Hypothalamus is linked to the limbic system. So your emotions really affect how the hypothalamus functions. And of course, the hypothalamus is the guy that tells you if you're hungry or if you're thirsty, and then it tells you to make gastric secretions. So hypothalamus linked issues. Curse you, hypothalamus. 5 bags of chips in. All right. Big bad hairy questions about female bits and pieces.
No.
All right, let's talk about coitus. Anybody else have a salt and pepper song in their head?
What?
Let's talk about sex.
Oh, coitus.
Talk about you.
You know, I thought it was hilarious how you said that the pubis bone could be broken if
It can. You
the way
just
you
gotta
said
be
coitus made me laugh.
All right. So again, in science, you can't say doing it in a scientific paper. That's kind of, not sciencey. So we have terms that we use. So again, coitus, that is Latin for coming together. So that's the one used most often, both in actual animal studies and human studies. Copulation, again, joining or coupling. And then, of course, intercourse. Intercourse actually means running between. So we do modify it with sexual intercourse. Because technically, if you have a stream going through a mountain pass, that stream is intercoursing through a mountain pass. Most people don't talk about that. Right? They go, look at I-40 intercoursing through Amarillo. Because you'll have other people going, what is it doing to it? Because, again, you got to modify it by sexual intercourse. All right, so physiology of coitus. There's going to be lots and lots of body changes. Now, when we look at the body changes, a lot of those changes are run by the autonomic nervous system. So we're going to see things that we saw in A&P1. So the same reactions that we have with rage, with fear, with excitement, a lot of those are going to produce a lot of the same reactions, because all those, whether we're really angry or really excited and happy or really scared, we get autonomic nervous system responses. So increased heart rate, increased blood pressure, facial funniness, that kind of scenario. So rage, anger, sexual arousal all result in increased heart rates, blood pressure, respiratory rates. Again, those autonomic nervous system responses, the sympathetic nervous system responses. So the people that first looked at the sexual response cycle was Masters and Johnson. They looked at the physiological aspects. What is the body going through whenever you're sexually aroused and completing the act? So the study of sexual responses actually started back with Kinsey. So Kinsey was a scientist who studied gall wasps. So gall wasps are the little wasps that lay eggs in tree bark that make the bumps on trees. So I'm sure he was a very interesting fellow. Okay? So this was like back at the turn of the century, early 1900s, back when you couldn't say things like sex and stuff because it was just frowned upon and nobody talked about it, because we don't talk about that kind of stuff. So Kinsey made basically an earth-shattering book series. It was what turns a person on. So he first talked to guys, and he went around to different bars, different locations, college, universities, and he just surveyed people. And he asked, what turns you on? What gets you excited? When was your first time? When was your last time? Who have you been with? What are your pre-date festivities? He did all this stuff. He's the guy who came up with the whole sexual scale where today you're the gayest gay, tomorrow you're the manliest straight guy, and somewhere in between. And depending on yes girl days, you might be a little bit over here. And depending on beard growing, you might be over here. So you'll have that response that what is you attracted to, what is turning you on, all that kind of scenario. So he released his first book all about the male. And that made huge waves because, again, it was the first time anybody studied sex in humans, just like they've been studying sex in animals for centuries. And it was ground shaking because half of the people were mortified that he wrote stuff like that in his book. What do you mean a 13-year-old boy got an erection while they were in mass? You're like, I'm sorry, it happens, I guess. All the way to all those reactions. So that really put him on the map. That really got his career going. And then a few years later, he did the same thing with women, went and asked everybody what was going on, what did they like, what did they didn't like, all that scenario. And then he wrote the follow-up with the sexual responses of the human female. That one was not as popular because when you hear about a guy sowing his wild oats, he's like, yeah, that's my boy. When you hear about mama getting busy in the back of the buggy with a random guy, it's like, not my mama. And so, again, there's that big cultural difference between we see men as they're proving how manly they are when they have sexual escapades, where a female is just a whore. You're like, oh, that's the same for the dude. He's like, oh, yeah, but it's a good whore. You're like, okay, good job. I don't know what. So, again, a lot of things. But he really opened the door for talking about sex in the academic setting, talking about sex out in the world. Okay, so before then, it was just something nobody talked about. So it was a very important first step. They even made a movie about it, which I found really weird. It had Liam Neeson in it as Kinsey. So it's weird seeing Liam Neeson not kill somebody in a movie. Right? Because every movie he's like, I will find you. I will kill you. Not in that movie. He's like, I will find you. Not kill you. And you're like, oh no. So he was the first guy. Masters and Johnsons came around in the 60s, and of course, this is the whole sexual revolution that Kinsey led up to, all the little happy hippies doing their things, and the drugs and everything like that helped open their minds. So Masters and Johnson looked at Kinsey's work, and he says, all right, Kinsey said this turns this guy on, this turns this guy on, this turns this lady on. And Masters and Johnson was like, what is on? What does the body do when you are aroused? Other than just saying, I'm hot right now. It's like, well, what are you actually physically doing? So Masters and Johnson started doing their own studies looking at what the body responses were to those different stages, different phases of sex. And can you confirm that, yes, that person is turned on and they're not just saying it to make you feel better about yourself? What is the body doing during these times? Ironically, they also have a TV show dramatizing their life. It's called Masters of Sex. It's either on HBO or Stars or one of those things you pay for to watch because there's boobs, and I don't do that. I have Dish. I pay enough already. I don't need to pay for extras. Okay, so there's shows about all these guys because revolutionary kind of stuff. So when we look at the sexual response cycle, the very first thing is excitation, right? We're getting excited, we're getting aroused, we're getting turned on, whatever terminology you would like to use. So this is a gradual change in a personal state of arousal from being the parasympathetic division, I'm relaxed at home eating Cheetos, about to take a nap, to the sympathetic division when my heart is racing and everything's going crazy kind of situation. So early signs of excitation, you're going to have penile erection, and that's a big obvious one there for the guys. So this again is caused because we release nitric oxide, causes the dilation of the arteries and veins. So blood rushes into the arteries of the corpus cavernosa, corpus spongiosum. Blood doesn't leave the venous system, so that causes that erection. Now, females, you also have a clitoral erection. It's just not as impressive because it's tiny. Okay, kind of have to look real close to see it doing anything. But you will have vaginal lubrication about 3 to 5 seconds from the point of excitation starting. So she's just as ready for as the male is, it's just not as obvious. The males, the parasympathetic stimulation leading up through the excitement phase is going to cause elevation, thickening, and flattening of the scrotum. So the cremaster muscle is going to contract, the dartos muscles are going to contract. That's going to push the testis close to the body. Again, that's going to shorten the length of the vas deferens, making it easier for the sperm to get out. And of course, safety mechanisms to make sure that nobody is injured during the encounter. In females, you're going to have expansion and lengthening of the vagina. Again, a unaroused vagina is about 3 to 3.5 inches. An aroused male is often bigger than that. So we have to accommodate so we don't have any injuries. Nobody wants to tear anything. So you're going to have that vagina get to be about 6 inches long for most females to accommodate the male and his erection. This is also how they can tell the difference between rape and consensual sex. So if you watch enough, Law and Order, SVU, I think I've seen all of them. And my 4 kids are like, are they getting raped again? I'm like, no, this is criminal intent. SVU's next. They're like, okay, murder, scotches, right? Law and Orders.
Yeah.
Either the murder ones, the maybe possibly embezzling money ones, and the sexual ones. And then organized crime. All right. So when you look at the cervix, it is often described as a clock, okay, because of the circleness of the cervix. When a female is aroused, she's going to lengthen the vagina that tucks the uterus back. That way it doesn't get injured during sex, okay, because an injury, again, can cause issues on both sides of the parties, okay, because you can bounce off that cervix and cause some damage on the guy just like you can on the girl. Now, when a female has sex, she will always have some kind of damage to the cervix. Now, this isn't like, battle score, oh my gosh, damage. It's usually microabrasions, kind of like rubbing skin. So you might get a rash or something. So many times you have to have special cameras and microscopes to see the damage. So it's not like, she just got a fist fight and it's evident or anything like that. So when a uterus and vagina move out of the way for sex, you're going to see more damage between 11 and 1 o'clock, okay? Because again, when it lengthens, the uterus kind of tilts up a little bit. So the top of the cervix is closer to the end of the vagina than the back. So anything coming in is going to hit about here. So that's the female was aroused when sex occurred. If she has damage between 5 and 7, she was not aroused when sex occurred. The vagina did not lengthen. And if the vagina did not lengthen, the uterus sets lower, and the bottom part, 5 to 7 of the cervix, is a little bit closer to the exit port, and you'll have a lot of damage there. So during that rape kit, they will take lots of microscopic pictures of the cervix, and if the damage is here, that's medical evidence that the woman was not aroused during sexual encounter, which means she was raped. Now, this is where you can have issues, because if she was aroused and her body says yes, but her mouth said no, it's still rape. Okay, that's where date rape becomes issues, because if the damage is up here, her body was willing, even if her brain was not. And then it becomes a he said, she said date rape issue. Okay, so that's why they check this. And then if we have questionable damage up here, then they have to go with other evidences that we may have, his word versus her word and stuff like that. which is why rape can be difficult in some cases because bodies may be willing, but the brain may not be. You will also have the elevation and flattening of the labia majora, because again, the scrotum and the labia majora are essentially the same thing. They're homologous structures, so they're going to pull up and out of the way to make sure there's access for the male. You'll have nipple and breast tumescence. Tumescence is the science way to say get hard. Okay, so you'll have nipple erections essentially. You'll have color changes in the labia minora. You're going to have a lot of blood flowing down there. So when you have a lot of blood rushing to the area, when you have fleshy tissue that doesn't have coloration and lots of capillaries, it's going to go bright red. Okay? This is something you could actually see on monkeys, not that you're watching that, but when female monkeys are in heat, they change colors. And that's what allows a male monkey to know that she's in heat. It'll go bright red or blue. Okay? I didn't watch enough monkey shows.
You're talking about the breasts or?
No. We've moved from there. We've moved to the labia minora.
Oh, okay.
So whenever you see a female monkey in heat, her butt looks like it's on fire. It swells and gets really red and irritated looking. And apparently that attracts the males.
It's the bright colors.
It's the bright colors. It's actually why mandrills have blue and red on their faces on the males. It's to confuse other males because it looks like a female vagina on the male's face. So if you thought your life sucked, at least you're not a macaque and look like a vagina.
Oh my God.
But yeah, that's why they have those colorations. It's all with confusion, sexual things. Okay. You'll also get a sex flush. This is when you get a pink or red rash across the chest or breast. Again, females are more likely to have this because females have more blood vessels in their skin than males. So that's why, again, females blush more frequently. And a sex flush is just blushing on more than just your face. So both sexes can have it, but more common in the females because of all those blood vessels. All right, I'm sorry to get you excited and then stop all weekend long until next week. Sorry. You'll just have to plateau next week.
Oh my God.
I know.
Funniest class I've been in yet.
You're the only one.
Yo, some of the stuff she said was